Good afternoon, everyone. I'm Dr. Morgan Crossman, and I'm thrilled to invite you into our space today for our January Vermont Early Childhood State Advisory Council meeting. And for those of you joining the meeting today, we're really trying to focus our efforts on understanding and grounding ourselves in the data and reports, as well as family and community voice to understand our current outcomes, challenges, and opportunities to support kids and families in the coming legislative session. And we're bringing a couple of different documents to you today and a couple of different reports to really help you see these documents as tools to inform policy and to guide decision-making through the coming year. And so in terms of our goals for today's session, we're going to spend a little bit of time with the data and the content from our annual State of Vermont's Children Report, and then learn about a couple of recently submitted legislative reports, again, really grounding ourselves in the current data and the current status of early childhood education, of pre-kindergarten education, of workforce, and some work on the doula report as well. In terms of housekeeping for today's meeting, for those of you who are just joining us for the first time via Zoom, we'd invite you to make an introduction into the chat. And for those of you who are on the State Advisory Council, we're asking you to do your best to keep your camera on for today's meeting, especially during the business section of the meeting. For others of you who are joining, we're going to invite you to turn your camera off until we get through the SAC business part of the meeting. All right, Elisa, if you want to go through roll call, I'll transition to you.
Sure, thank you. I was just doing my lunch, so appreciate the extra minute. So hi everyone, I'm Elisa Stolberg. I am Director for Family and Child Health at the Health Department, and I'm the public co-chair of the SAC. And I'm just going to do a quick roll call. When I call your name, if you can unmute and say that you're here, that'd be awesome. So starting with Janet McLaughlin.
Hi there, I'm Janet McLaughlin, a Deputy Commissioner for the Department for Children and Families, overseeing the Child Development Division.
Thanks, Janet. Cheryl Wilcox.
Hi, everyone. Cheryl Wilcox with the Department of Mental Health. I'm the Director of Mental Health Collaborations.
Zoe Saunders.
I think Zoe will be coming on around 2, so I'm not sure if Tammy or Meg are here in her place.
Tammy's here.
Hi, Tammy.
Hi.
Monica Ogilvy. Not seeing Monica. Susanna Davis. Okay, Renee Kelly.
Hey everyone, thanks. Hang on, help if I turn my camera on. See you all, feeding a small human being. Renee Kelly, Vermont Head Start Collaboration Office.
Thanks, Renee, and your small human being. Jessica Vintner. Okay, and Carly Tebow.
Hey, good afternoon, Carly Tebow, Family Services.
Carly, your name does not match you, so it's confusing.
That's true. It looks like Alyssa. Thank you. I didn't even notice that. Yeah, I couldn't find the invite. So Alyssa, who's on already, did a quick forward to me. So you'll see 2 Alyssas on this call. I'll see.
Terrific. Representative Jessica Brumstead. Perhaps not here yet. Senator Ruth Hardy.
So Senator Hardy has just transitioned off of the board, but I would love to have Senator Gulick introduce herself.
Hi, everybody. I'm Senator Martine LaRocque-Ulick. I live in Burlington and I represent Chittenden Central. I am Vice Chair of the Senate Health and Welfare Committee, and I serve on the Finance Committee in the afternoon. Nice to see everybody.
Welcome.
And Ray Garofano is actually on as well, Elisa, from House Human Services, if Ray has a minute to introduce herself.
maybe we could come back to that.
Oh, sorry. Before you go on, sorry, I'm on my phone. Apologies for not having the camera on. Ray Garofano, represent Essex and Essex Junction, Vice Chair of Human Services. Nice to see you all.
Good to see you too. Welcome. Moving on to our private at-large members, my co-chair, Floor.
Hi, everybody. Good afternoon. It's great to be here with you, Vermont School Boards Association.
Thanks, Floor. Erica McLaughlin.
Erica McLaughlin, Assistant Executive Director for the Vermont Principals Association.
Sharon Harrington.
Everyone, good to be with you. Sharon Harrington, Executive Director of Vermont AEYC.
Thank you. Christy Swenson.
Hi, I'm here. I'm Christy Swenson, and I represent Head Start on the council. Sorry, my computer is saying that my camera isn't attached, but it's integrated, so that'll take a little more digging for me to figure out.
Thank you, Christy. Danielle Mitchell.
Hi, everyone. Danielle Mitchell. I'm the Children's Director out of Washington County Mental Health Services.
Thank you. Carol Lang Godden.
Good afternoon, everyone. Carol Lang Godden. I'm the Executive Director at Lamoille Family Center, and I'm here representing the Vermont Parent-Child Center Network.
Dr. Deb Hartswick.
Hi, Deborah Hartswick, retired pediatrician and representing medical professional on the State Advisory Council.
Thank you. Libby Dalian.
Hi, everyone. Libby Dalian. I'm a parent representative, and I'm based in Winooski.
Eddie Gale.
Hi, Eddie Gale. I'm the Vermont Program Director with the A.D. Henderson Foundation.
Fiona Heath.
Hi, everyone. Fiona, Director of Trauma Informed Care at the Vermont Network Against Domestic and Sexual Violence.
Dimitri Garter.
Hi, everybody. Dimitri Garter. I'm the business rep on the State Advisory Council. Good to see everyone.
Becca Webb.
I'm a universal pre-K coordinator for 10 school districts down the middle of the state.
Amber Houston.
Hi, everybody. I'm Amber Houston. I'm a parent representative to the State Advisory Council.
Thanks, Amber. And Monica Hutt, who is taking over as the governor's point of contact. Don't see Monica. Morgan, is there anyone who sent their regrets? Formally, okay. Terrific. So I think that's the roll call, and I'm going to pass it over to Floor.
Hi, everybody again. Are you guys ready to vote on our minutes? Could I have a motion to accept our minutes for November 4th, please? And then we can have discussion if needed. Any volunteers for a motion?
So moved.
Thank you, Dimitri. A second.
Happy to second. This is Cheryl.
Thank you, Cheryl. So any amendments to the minutes? Everybody had a chance to look at them in the packet? Seeing no hands up, all those in favor, please signify by saying aye to approve the minutes.
Aye.
Aye.
Any opposed? Any abstentions? Hearing none, the minutes have passed. Okay, so back to you, Morgan.
All right. So now we're going to talk a little bit about the State of Vermont's Children Report, and our Research and Data Director, Dora Levinson, is going to walk us through that intro.
Thanks, Morgan. Good afternoon, all. As many of you know, at the start of each year, the legislatively mandated State of Vermont's Children Report provides Vermont's policymakers, educators, caregivers, health practitioners, business leaders, and community members with an objective, data-driven assessment of the well-being of children and families. The report includes a profile of each of Vermont's 12 regions and the 2025 policy recommendations. Our data spotlight this year focused on Vermont's child welfare system, and our briefing held on January 13th included 3 expert panelists who shared the successes and challenges with the current system and the information they most wanted legislators and decision makers to know. Overall, the report includes over 100 contextualized indicators from both publicly available data sources and indicators that were shared or created specifically for this report from data stewards across the early childhood system. And now I'll pass it to Beth to tell us a little bit about the shared activity.
Thanks, Dora. So we're going to give you a chance to explore the report just a little bit in pairs. So I am working to set up some small groups, and we're going to put the link of the report in the chat to start. So I'm going to get that in here and invite you to open the report. And if you haven't looked at it, it's pretty cool. And then no expectation that you're going to read the whole thing. There's a lot there, but inviting you to turn to a page and identify one data point or one chart that looks interesting, and then you'll be put into a small group and have a chance to, or a pair, to just try and make sense of that data point with your buddy and think about what sticks out to you about it. What does this data mean to you at a personal or a professional level? Then you can swap and the other person can kind of share the data point that they were looking at. And then we'll call you back together. So really just inviting you to look at one small piece of the report and hope that you will go back and look at it in a little bit more depth at another point. So with that, I am going to put some questions in the chat and invite you to open the report and take a look while I set up the small groups. And we'll be in small groups for 10, 15 minutes and then call you back. Any questions? Okay, so take a moment to look at the report. Choose one data point just to orient you to the report. There's quite a bit of, there's several pages in the front end of the report that are letters like from the governor and our policy recommendations. The pages that I want you to look at starting on page 13 is kind of the main sections of the report, and then we have regional pages with regional data starting on page 34. So really anything after page 13 is what you want to look at. So take a moment to get oriented, set up the small groups. All right, I'm going to open the rooms, and if you haven't found a data point, it's okay. You can take a little bit more time with your partner before you get started. I'll let you guys navigate that.
Welcome back, everyone. So I hope what you're seeing from us in terms of this January board meeting is taking a little bit more of a proactive and concrete approach to orienting the board to data-driven decision-making. How do we know what data is available? How do we help orient you to that data? How do we spend time talking about it? And as we're coming into a new legislative session and new political landscapes, I also think it's really important for you to hear us talk a little bit about what we mean when we say data-driven decision-making and what that kind of vision is and how we can bring that into this legislative session and to support decision makers, those of you on the board who are in decision-making authority, whether it be from the administration or from the legislature, and then also those of you who are community partners and how to use that data to help inform decisions. And so when we think about data-driven decision-making as a board, my hope is that we can model first prioritizing and grounding our work in data and how we understand the experiences of young children, as well as service provision and outcomes for kids and families. And second is how we commit to transparency and making that data publicly available and that reporting more available and visible and accessible to folks. So that's also why you're going to hear from key partners today talking about some of the legislative reports in addition to things like the state of Vermont's children. And the third piece of that vision is how do we each in our respective roles actually use that data for decision making? How do we translate what we just read into continuous quality improvement? How do we know if we're making an impact in our policies? How do we improve and strengthen our programmatic decisions? And so what we're going to try to do as a board over the next year is create space for you to come together, to learn, to share, and discuss a range of different data reports and topic areas so that as we move through the session and as we move through partnership in the next year, you're really informed on each other's priorities. So some of those pieces will be reviewing key reports that are produced that are going to impact key policy areas in the state of Vermont for kids and families. We want you to be able to talk about and debate your policy priorities. What are the key efforts that within your respective lens you are leading and monitoring or would like to learn about? When are you providing legislative testimony? So many of you in this space, virtually on the board, but even those of you who are joining us to tune in to the State Advisory Council meeting today are providing testimony. For those of you on the board, we want you to know what those priorities are. Are they shared priorities? Are there things that we across different content areas need to debate and discuss? We also want you to be sharing data with each other. Share those indicators, talk about the qualitative experiences of families, of communities, of your people in the different realms, and bring that and share that with other board members. And then lastly, we want you to be able to ask for data that you need or ask questions about whether or not data exists in that specific area and what those limitations are so that we can have a better collective understanding about the impact that the services are having on our kids. I think in the next couple of minutes, as we transition into some of these presentations, we really want to provide you the opportunity, just as we have in the past 6 months, to have the board table be a place where we can hold hard conversations and really debate early childhood policy. And in order to do that really well, you need to understand each other's priorities, the perspectives, the philosophies, the values that you're coming in with this, into the board table with, as well as the data, the challenges and opportunities. So today's meeting is a place for you to hear about 3 of many legislative reports that have either already been submitted or are recently submitted to the legislature, so that you can hear from partners who have been deeply invested in that work, but then have time together to talk through it and discuss it and ask key questions. The 3 reports we're going to dive into today, the first is the Pre-Kindergarten Education Implementation Committee report. So I can't see in my virtual squares. I see Janet, but I have, is Zoe here?
No, she's not going to be able to make it.
Okay, all good. So Janet McLaughlin, who is the Deputy Commissioner for the Child Development Division within the Department for Children and Families, who has played a really important role co-leading that work alongside the Agency of Education, is going to discuss the PEIC report. And then we have Jennifer Collin, who is the General Counsel with the Vermont Secretary of State Office of Professional Regulation. And she is going to be sharing information about 2 reports. One is the Early Childhood Education Licensing Sunrise Report and another on doula credentials. In terms of logistics for the next little bit of time, we're going to have small group discussions at the end. And we're going to start with having Jennifer and Janet do their slide shares for about 10 minutes each. So Janet, if you're ready, I'd love to have you go first.
Hi, everybody. Good afternoon. First thing I am going to do for a second, because I want to make sure that you guys all have the website for the Pre-Kindergarten Education Implementation Committee, so you can find everything you need. So, and then I'll go into my slideshare. So I just want to make sure people have this. I can throw it in the link. But again, this page really aggregates all of the work of the Pre-Kindergarten Education Committee. Right, this was a committee that was formed out of Act 76. So, became law in June of 2023. And then has been worked together over the course of about 16 or so months to look at the future of pre-kindergarten education in Vermont. And so you can see this, there's a link to the final report there, some public comments there, and then also all the meeting information, agendas, the meeting minutes. So you can see, that the meetings of the full committee, as well as meetings of subcommittees and work groups. The members of the committee really took their responsibilities really seriously and really dove into the work, and got as far as we felt like we could get within the time frame that we had, with the group that we had, and with the resources that we had. Which means we did not get as far as the legislature had been hoping that we were going to, but we think it was a really meaningful contribution to kindergarten education in the state. I want to just flag in terms of the committee members. Again, I was the co-chair throughout. Agency of Education, Zoe was our final co-chair. Secretary Saunders was the final co-chair, but Interim Secretary Boucher was with us before then. And both Meg Porcella and Tammy Bates from Agency of Education were also really helpful and active in thinking about all the work of the committee. In terms of the State Advisory Council, we've got Erica McLaughlin and Morgan Crossman, Renee Kelly, and Sharon Harrington and Rebecca Webb are all State Advisory Council members who are also on the pre-K committee. So I just wanted to recognize their work and their contributions, and you guys will have some great thoughts to share as well. So I'm going to stop there, and I'm going to get into now I'm going to go to my slides for a second. Series. Now we're slideshow. And then I'm going to throw past a bunch of these because we are some of these I use. There's like a background on pre-kindergarten education and universal pre-kindergarten as it stands right now that we shared with the legislature last week. So those slides are there and they can be sent out as part of the meeting materials, but I am not going to spend the time to review those today. So again, the committee was formed by Act 76. It was co-chaired by with a leader from Agency of Education and from Child Development Division. And the legislature charged the committee with looking at 4 key changes to our universal pre-kindergarten program. So first, looking at full school day, full school year for pre-kindergarten education. Right now, it's structured as a minimum of 10 hours a week for 350 for 35 weeks a year. Some school districts choose to do more in their publicly operated programs. But that 350 sort of is the starting place. And they were saying, what would it look like to get to full school day, full school year? The legislature also directed us to look at having, really thinking about it as the year before kindergarten. So really 4-year-olds and 5-year-olds not yet enrolled in kindergarten, and transitioning 3-year-olds out of a publicly funded pre-kindergarten education benefit into childcare, if that was possible for that family. So they asked the committee to look at that. They asked us to look at what it would mean if the school district was assigned the responsibility of providing space for all eligible children. So right now, children are entitled to a pre-kindergarten education, but there's language in the statute that talks about in any available pre-kindergarten education spot. So it does mean that there are some, it's up to the family to find a pre-kindergarten education spot that works for them. And it does mean there's some families who are unable to find a publicly funded pre-kindergarten education spot. So this would assign the school district with that responsibility. And it would also give the school districts a little bit more choice. Right now, as to whether or not they want to partner with community-based private programs or with other public schools, or offer it directly themselves, or some combination. Right now, it's really family choice, where the families choose which program they want to take part in, and the school district needs to provide that tuition support as long as that program has been approved by the state level to offer pre-kindergarten education. So those are the 4 changes. What you'll find on the next slide is not that we answered all of those questions by any stretch. So again, the committee did a ton of work. I tried to show that to you in showing just sort of the volume of just the number of meetings that we had, the resources, and there's a ton of resources and tools. When you look at the report, there's a ton of analysis that was done, but we were unable to really vote on a full suite of recommendations, given sort of the limitations, as well as sort of we had, the committee that we were given sort of as a volunteer committee, people doing it off the side of their desks, doing the need for some more robust data and data analysis that we weren't resourced. We didn't feel like we had the information necessary we needed to answer all of the questions. And also, right, the sort of education financing universe really changed dramatically between June of 2023 and really last spring, when the committee was really starting to dive deep into its work. And we did spend a lot of time looking at national best practices for pre-kindergarten education in terms of access and quality, and seeing how Vermont was doing on those factors, of which Vermont's really doing very well, like one of the tops in terms of access, really meeting most of the national benchmarks for quality, though there still is room for us to make progress on some of the educator qualifications, both classroom teachers, supporting educators, coaching for educators in all settings. So there definitely is room for improvement that the committee talked about, but we didn't get all the way there in terms of getting to so what specific recommendations would we have on those topics. We did have a vote on four specific recommendations. So one, wanted to maintain a pre-kindergarten education program for both 3 and 4-year-olds. This took a lot of time in the committee to sort of discuss the pros and cons there. And ultimately, every single committee member voted in favor of keeping 3-year-olds, with one exception. And that person actually noted that if it had been stated as an entitlement rather than a benefit, they would have voted for it. So it's more like they didn't even think it went far enough. So really focused on maintaining for 3s. Said, yes, we should expand for kindergarten hours and services, and we should start with 4-year-olds. So agreed with 4-year-olds as the priority for expansion, but also recognize the need that within the funding environment we were in, we needed to really make sure we were clear on what the cost would be before planning for and staging out an expansion plan. So recognizing that the current pupil weight formula really looked at K through 12 and didn't include a pre-K weighting. So a recommendation to update the pupil weight report to conclude pre-kindergarten, and as well as to review the methodology that we use to establish pre-kindergarten payments to those community-based partners, and to propose updates because the methodology hadn't necessarily been updated, and it wouldn't be easy to update for different numbers of hours if that's what was being considered. So that is what the committee recommended officially. And then here were some of the considerations that were identified by the committee. Strengthening data collection and analysis to really inform the future changes, just recognizing we need that information. We want to have a data-driven system, and that there is some key information that should point to both successes of the current systems and our areas to grow. Build on our use of best practices and ensuring access. Again, we're some of the top access in the nation for both 3s and 4s. We want to build on our foundation of quality and meet additional national benchmarks. And that we need to take the steps to strengthen and streamline implementation, recognizing that the current system is complex and there's some ways for us to simplify it. So that is the briefest nutshell of the pre-K report.
Thanks, Janet. Do you want to pull down your screen share just for a couple minutes? I think we have time for about 2 or 3 questions if folks want any clarifications. And again, if we aren't getting to all the questions here, we are going to break into small groups to have discussion about what you heard and be able to look more at the links and have conversations. But any questions from State Advisory Council members? Or for those of you who are on the committee, if there's anything that you would like to add. Floor.
Hi, thank you, Janet. This is not going to be surprising because it's something that we have talked before. How do the recommendations move these particular 4 recommendations or agreements that you're saying move the Vermont toward more equitable access to high quality pre-K education where every child has access to a licensed teacher? I know that this is something that we talked in the past. Yeah. How does it embedded in there?
Yeah, I mean, so there's a long section in the report that outlines where we currently are and against national best practice. So, and looking at several different frameworks. And and then it looked at, we talked to the committee, the subgroup that was focused on that, talked to some other states and talked to some national experts about how have other states transitioned in terms of educator qualifications. And what were the supports and places that were put in place in terms of educator qualifications and what was a reasonable timeline. So that's all documented in the report. Again, it's a piece that everybody agrees that we should move towards those benchmarks. It's just a question of the national benchmarks. And then it's a question of like, how do we resource that and how are we not, I guess the trade-off, the question is, how do we not reducing access to a quality pre-kindergarten education during that transition time?
Thanks.
Sorry about that. I saw that the committee recommends an analysis of the pre-K weights. And my question around that is, have they not already been determined by, for example, like the Tammy Colby study that came out a while ago? And also, I know I've been drinking from a fire hose in the legislature lately, but I believe we were told in finance even last week that the AOE was recommending that pre-K students be weighted as 1 as opposed to whatever they were before. So I just was wondering if you could comment on that. Thanks.
Yep. So these things they're moving together, but also not quite, right? As you know, like in this process. And somebody correct me if I'm wrong, but my understanding is the study that you're mentioning, the Tammy Colby study, it was a K through 12 study and it didn't do the weights for pre-K. And then, so we don't have it analyzed in the same way as other grades. And then there was one of the other products sort of a year ago, as the committee looked at pre-K costs, the committee said, we agree that a full-time pre-kindergarten student would not cost less than a kindergartner. So if a kindergartner is 1.0, then a pre-K student is at least a full-time pre-K student would be at least a 1.0, and then said, and probably more. And that's why we need to have the study, because we know that just the staffing needs for younger children, plus just, the infrastructure needs are different for younger children. So, and yes, this is sort of an active part of the discussion on education finance. And so I think as the pre-K committee, we were like, we're not solving that in this little group of people right now. So we're going to put a pin in it here and we'll take it up in the broader conversation around education state.
Thank you, Janet. Am I possibly hearing, though, that maybe pre-K should be weighted above 1? Is that? Yeah.
That's what the committee recommended. Yeah.
Okay, thank you.
Mhm.
All right, one more question. Erica, go ahead.
It's not a question, just appreciate Janet's synopsis, and would like to add to your question, Senator Gulick, it would be a step in the right direction to have at least a 1.0, because right now it's only a 0.46. So there was a lot of discussion, as Janet mentioned, that even if we could get to a 1.0, schools would benefit greatly, as that other study is being done.
Thanks, Erica. Any other PEIC members want to add anything before we transition? All right. Thank you. Thanks, Janet. And for those of you who have not taken a look at that report yet, again, I think the report is very valuable, but the amount of data that was captured and analyzed and put into appendices in that report is also incredibly valuable. There's a quality matrix that, again, situates Vermont in the national context, but also across a range of different standards across public and community-based settings. There's a ton of very valuable data that was captured on behalf of school district superintendents. Erica and others did a really great job of really trying to engage our public education partners and understanding perspectives of what is possible as we think about the possible expansion of universal pre-K. So inviting you to not just read the report, but really dive into the links that are a part of that report, because there's so much valuable information throughout. All right. Let's transition now to Jennifer. I'm not yet seeing your square, but I believe my team told me that you're here as well. And so we'd love to have you start. And Jennifer, if you want to start with the Early Childhood Education Licensing Sunrise Report and then transition to doulas, we can do questions after each of those and then transition into small groups.
Okay. Unfortunately, our slideshow started with doulas, so we did it the other way.
That's totally fine.
Well, good afternoon, everybody. My name is Jennifer Colin. I'm General Counsel at the Office of Professional Regulation. And for those of you who may not be familiar with OPR, we are a public protection agency that oversees occupational regulation for 53 different professions. We regulate over 80,000 individuals and businesses that are operating in the state of Vermont. We have everything from dentists and pharmacists, osteopaths, nurses, to real estate brokers, architects, land surveyors, to professions such as tattooists, barbers, and cosmetologists. It really runs the gamut. So it's an exciting place to be. And it's been an exciting time for OPR because we've really been getting into this area of children and families and really focused on that here in the last 6 months or so, because we were asked to report on 2 different new potential regulatory programs for community-based perinatal doulas and early childhood educators. So if you could go to the next slide, that would be great. Thanks. And apologies for having very dense slides. I wasn't sure how oriented y'all were to these different topics, but essentially on the community-based doula Sunrise report, OPR was asked to evaluate whether doulas should be a regulated profession, and the legislature asked us to do that evaluation. And when we're looking at whether to regulate a new profession, we have an assessment that we have to do where we look at various criteria that are set out in Title 26, Chapter 57. And basically, we're focusing on what are the harms that occur if there's no regulation of this profession. What are the potential harms? And is there another way to kind of remediate those harms other than professional licensing or regulation? So for doulas, we were looking at this issue because there is a maternal health crisis in the United States. You'll see on the slide, we have the highest rate among developed countries of maternal mortality and morbidity. And there was a sharp increase in 2021 in maternal mortality rates. So research has shown that, there are substantially disparate outcomes for underserved and under-resourced population, BIPOC communities, rural communities. Those families are seeing disparate maternal mortality and morbidity rates. And the CDC has reported that of that high number of maternal deaths that we are seeing in the United States, 60% of those are preventable. And so what are the tools that we have to kind of combat that unacceptable outcome? Looks like community-based doulas are a significant tool in our tool belt that we can use to lower maternal mortality and morbidity rates. And essentially, doulas provide non-medical, non-clinical support to birthing individuals. And it's emotional support, it's education, it's physical support before, during, and after labor. And community-based doulas are working within under-resourced, marginalized populations at low or no cost through agencies to provide those services to folks who can't afford to have private pay doulas. Doulas have traditionally been a private pay profession, which means that access to those services can be very limited for people. And what research shows is that folks who have access to doula services have better health outcomes overall. They have lower rates of cesarean delivery, lower rates of birth complications, lower rates of low birth weight, and they simply have better maternal outcomes, higher patient satisfaction, and better healthcare experiences. So it's really important to try to increase access to doula services. And in doing our research for this report, we learned that 38% of births in Vermont are covered by Medicaid. And what we also learned is that Medicaid recipients are more than 80% likely to experience severe maternal morbidity. So when you see that high impact on Medicaid recipients and how many folks in Vermont are covered by Medicaid in the birthing process, you can see that there's a connection that can be made there to lower those poor outcomes. So if we go to the next page, you'll see that in Act 97 in 2024, the Vermont legislature determined that it is necessary for the state of Vermont to regulate doula services for the public health, safety, and welfare. So that's usually a part of the analysis that OPR does in its reports, but the legislature made that determination for us, so that took off a little bit of work from our analysis. But then the legislature asked us to determine what form of regulation would be most appropriate for this profession. And so we looked at the factors in Chapter 57 of Title 26, and we engaged with stakeholders, we held public hearings, we solicited public comment, and we did a lot of research. And in going through that process, we determined that it's not necessary for the state of Vermont to regulate all doulas. So in that private pay doula realm, there's no real harm that's coming from that private pay practice. So we don't want to over-regulate. So what's a form of regulation that we could do that doesn't cover all of doulas? And where we landed was a certification of community-based doulas. And basically, a certification is a voluntary credential that folks can get. And it requires that they have certain training, education, and or experience, not necessarily all three, in order to obtain that certification. And what that will do is, Act 97 made it clear that the state is looking to open up Medicaid coverage for doula services. So that would provide, Medicaid the assurance that the folks who are practicing in the profession are appropriately trained to offer culturally competent and congruent doula services, so that we can get those poor outcomes that are occurring within marginalized populations, so we can lower those outcomes. So that was our conclusion in the doula report, a certification. And I have a slide at the end about timing and where we expect that to go. But we expect there to be legislation this season, and we'll talk a little more in a minute about the rulemaking process that we'll have to go to. Okay, so next slide. We also did a.
Jennifer, I wonder if we want to pause and have folks be able to ask questions on the first one. Sure. And then transition, only so that we have different content areas.
Okay.
Awesome.
Totally fine.
Thank you. State Advisory Council members, any questions about the doula report or Jennifer? Senator Gulick.
I have another question. I'm full of questions today. This was actually, I didn't see it in the report, but it's a question I've been meaning to ask. I know that Blue Cross Blue Shield did a pilot study for doulas. Do you all have any information about the outcome of that pilot?
We did actually review that, the testimony given by Blue Cross Blue Shield to the legislature about that program. But in terms of like final outcomes, I'm not recalling off the top of my head what those were.
Okay, thanks. I'll try to find out on my end.
Mm-hmm.
Any others? All right, Jennifer, if you want to move on to early childhood education.
Yes, thank you. So there's a couple of ways we get requests to regulate new professions. One is from the legislature, like we did with doulas. And then the other way is folks can file an application with our office to review a profession for a potential regulatory program. So in May of 2024, the Vermont Association for the Education of Young Children filed an application with our office asking for OPR to assess the early childhood educators as a recognized profession. And so I just filed the report on Friday. That's available on the legislature's website. It's a very long read, 86 pages. So there was a lot to it. And certainly we at OPR, this was kind of a new realm for us. So we had a lot of catching up to do, and did our best to read everything that we could about the early childhood education landscape in the state, access issues, quality issues. Building Bright Futures reports over the course of the last decade were very helpful to us in kind of understanding where we are right now. And so I just wanted to mention that we read everything we possibly could, but I'm sure there's more out there that we didn't read. But essentially, in reviewing the current system, OPR found that, we have a mixed delivery system. It's very important in the state of Vermont because we're a rural state. And individuals who are teaching in the child care homes and in the centers, they do have to have background checks and trainings and qualifications, but they're not afforded an individual license, and they're really kind of regulated through the facility. And ultimately, the facility is bearing responsibility for the conduct of those folks. And there's no public accountability for folks who are working in that profession. And, you know, it's a complex system where facilities are having to vet the qualifications of staff that they want to hire. And ultimately, OPR determined that that it would greatly positively impact the growth and health and development of children if this profession was regulated, and if there were clearly articulated qualifications and standards that the teachers and assistant teachers had to meet. You know, children from ages 0 to 8 their brains are developing rapidly, their bodies, their whole systems are developing rapidly, and early experiences are very crucial to that development. So whether those are positive experiences through high quality early childhood education, or whether those are negative experiences where there's no access to that high quality education, that impacts people for their whole lives. It impacts your physical health, your emotional health. It impacts, you know, your education, your learning. So those are really high stakes, and children from the ages of 0 to 8 are our most vulnerable population. So OPR took a very close look at, you know, whether there should be individual accountability for meeting standards to ensure that high quality education can be delivered through regulated professionals. And we determined that that folks in this profession should be regulated, that there should be licensure for early childhood educators. Having licensure will increase the quality of services that are being provided to children and families. It'll reduce poor outcomes from low quality childcare and early learning. It'll increase children's school readiness. The educators who will be licensed will have to meet the same standards as folks who are working in public education. So that will kind of get children ready to enter public education when they hit kindergarten or pre-K. Also, streamlined preparation pathways. Right now, there are a lot of different pathways to get into being staff teachers at state regulated settings. And we determined that the profession would really benefit from streamlined pathways and qualifications to ensure those necessary minimum qualifications to provide high quality education. Also, another benefit of increasing qualifications and accountability for professionals is creating a professional identity that attracts folks to the profession, and you know, will enable folks to pursue a career. Act 76 provided a lot of financial supports and subsidies that will hopefully increase and that are increasing, you know, the pay that the workforce is able to get, and potentially having those folks get benefits. Right now, there's a big disparity between folks who are working in public education versus those who are working in these state-regulated private settings, and you know, a lot of teachers are choosing to teach in public schools because that's the only way that they can get benefits, pay, and professional recognition. So we think that offering licensure for folks who want to be early childhood educators will provide a lot of benefits for children, for families, for businesses and employers in the state. And, you know, it is a significant change. You'll see on the next slide, we're recommending 3 types of licenses, ECE1, ECE2, and ECE3. The ECE1 is kind of what's known at this point as an assistant teacher. It's a support educator role, and you'll see there the qualifications that someone would need to have to obtain an ECE1 license. ECE2 and ECE3 are the lead educator roles, and you'll see you know, ECE2 requires an associate's degree, and ECE3 requires an approved bachelor's degree. Right now, there's not a national examination because there's no other state that regulates in this profession, regulates early childhood educators in this way. But at some point, if there is a national examination, that's something that we would also look at to determine whether folks should have to take and pass that. Now, this is a significant change, and, you know, OPR spent a lot of time talking to and listening to folks who are in the state regulated settings and, you know, people's concerns about making this big change. And we did devote quite a bit of time in the report to addressing those concerns, but OPR thinks it's really important to have transitional measures so that folks who are working in this profession can make the transition. We don't want there to be a, you know, we don't want there to be folks who aren't making the transition. We want to welcome everybody in, provide licensure, and then allow folks adequate time to obtain the whatever education it is that they're still needing to obtain to have those credentials. So we've tried to be very thoughtful about those transitional measures. We've had a lot of conversations with different folks from within the profession to come up with those transitional measures. And what we anticipate is that it's going to take a lot more conversation to kind of think about what the details of this profession would need to be so that we don't lose providers, we don't lose educators, and that we can maintain the access that we have at this point and build upon that. So this was a significant study, and lots of, you know, we're going to have to pay attention to the details because there's going to be lots of coordination with CDD, lots of coordination with folks who are already working in the professions to try to make a smooth transition if this legislation passes. So, and then if you wanted to go to the next slide, I can talk about what's coming up next for both of these, and I'm happy to take questions. So we do expect bills for both community-based perinatal doulas and early childhood educators, and we're thinking that at this point, community-based doulas, that would be a program implemented in 2026. We do need to go through the rulemaking process before we implement that program, and we're going to have to be closely connected with Vermont Department of Health Access to make sure that the details of the certification meet Medicaid requirements so that folks who need those services can have those services through Medicaid. And then for early childhood educators, we're, you know, 2027 is about the earliest that we can see that there could be issuance of any type of license. And again, one of the transitional measures that we've proposed is a transitional license, so that if folks don't meet the qualifications by that target date, that they would still be able to have a license, practice in those professions, and then continue to work towards getting the education that they need to meet the criteria. So rulemaking in both of those professions is going to be very resource intensive for us, but well worth it just to make sure that we get it as right as we can, working with folks who are within the profession and also sister agencies and other stakeholders. So happy to answer any questions. I'm sure there's going to
So
be
much.
a lot of you.
If you want to take down your screen share, I know that this is an area that several members of the board are incredibly passionate about, and I want to give folks time to be able to ask questions and to be able to discuss. So we're not going to transition into small groups. And instead, I invite everybody to stay in the space. And if you are a part of the State Advisory Council, please raise your hand if you want to ask a question or make a comment and talk with Jennifer about this report.
It's a lot to take in.
I was trying to practice that teacher pause. Erica, I saw your hand. Go ahead.
Thank you for sharing a lot of that information. I just want to say that I am, as you've said, Morgan, I appreciate it. This is something that I've been paying attention to in terms of the OPR early childhood education licensure. I have a lot of concerns around that, and also participated in that testimony where you were asking feedback on from the public. So some of what I'm going to say is probably familiar, but essentially this isn't a new license. I've been a principal for 17 years and I've hired early childhood educators probably all of those 17 years. So I think it's misleading to say it's a new license. And that brings me concern around the language of the licenses. I think if I was a private provider and maybe I was holding an early childhood one based on your chart, and I could say I'm an early childhood licensed educator, that would be a true statement, but it doesn't provide the transparency around the level of education that I endured or had the privilege of partaking, and it's just not transparent or clear. But I do understand the reason for wanting to have regulation, but I think that there are a lot of nuances that need to be adjusted to make that happen. So there's so much I could say, but I'll just leave it at that, given the time constraints that we have.
Sure. And, we definitely look forward to, we've had conversations with AOE. We've had conversations with folks who are licensed through AOE with that early childhood educator endorsement and early childhood educator special endorsement. And certainly we don't want to confuse the marketplace, but we recognize that there's a potential issue there. And, close collaboration with, again, like sister agencies and folks who are in the profession to make sure that, we're getting the right information out to everybody, and certainly making sure that, that everything that OPR puts on its website and all of the information is very clear about who it is that we're seeking to regulate. And it is those folks who are in the CDD regulated setting. So just as clear as we can be about that, certainly we want to be. But thanks for your concerns, and I'm sure we'll talk again at some point.
Go ahead, Senator Gulick.
Thank you. I just wanted to also voice my concerns around, propping up a whole new certification process and structure. It seems like a lot. We already have a lot of robust work that is being done there. And I'm also concerned about rulemaking. We're already hearing in the greater education universe that the AOE wants to kind of solely take on rulemaking. And that is just giving me pause to not have sort of the public facing rulemaking body that exists now. It just seems like there's a lot of sort of, for lack of a better term, power and control being consolidated at the AOE that it's just a little unsettling. And I just wanted to share that with folks.
Well, and thank you for pointing out that concern and sharing that concern. So when I say rulemaking, when we have professions, all of our professions are identified in Title 26, and each one of those professions, we go through an administrative rulemaking process at OPR. So this would be through our agency, where we connect with stakeholders, folks from within the profession, other agencies, and we have this is going to be a board profession if the legislation passes. So we will have a board of early educators who helps us with that rulemaking process. So that's that rulemaking would be through the Office of Professional Regulation and not AOE.
Thank you. Any other State Advisory Council members have any questions or comments before I open it to the public? Go ahead, Flor.
I was trying my very best to not sound like a broken record, but I have concerns similarly to what Martine just shared and what Erica just shared, and basically just putting out there that, you know, if we're all in this space, not just, you know, for our children attend public school, why do we, you know, if we all agree that public education is a public good, why do we need two different standards, right? So it's a licensed profession already. It doesn't need to be different to, you know, I don't know, we're trying to make something different. Is there going to be exceptions? You know, our kids are all the same. They, you know, like they all need the same things. They should all have the same standards. So whatever standard there is, so if you don't want the standard for public education, maybe the standard for public education needs to change, but we don't need two different standards or for being a early childhood educator. I just do not understand it. And I know that I sound like a broken.
Well, and to clarify who is going to be the intended regulated profession, it's folks who are providing education to ages 0 through 8, but it's in those CDD regulated settings of family childcare homes and center-based childcare and preschool programs. So this is not duplicative of what AOE does in public schools. It's reaching the children before they get to public schools and making sure that they have the same standards that are being used in public schools, so that one, they get the benefit of teachers who are highly qualified for their brain development, but also two, so that they're ready when they get to public school. They've been educated by folks who are trained in the same quality standards as our public educators. So it really is just trying to get to the earlier age children.
Thank you, Jennifer. I'm going to go to Christy. I'm just noting the time for folks. We have about 2 minutes left. I will still open for public comment, and we'll close with some of our national monitoring efforts. Go ahead, Christy.
I'll try to be as quick as I can. I just want to speak to this concern a little bit from the unique perspective that I have as a speech language pathologist, because I am licensed through OPR and I am also licensed through AOE because of the profession that I have chosen. And I don't feel like there's anything difficult about working with both, both places of oversight. OPR is looking at some aspects of my education and experience, and AOE is looking at some other aspects of my education and experience, and I appreciate that oversight.
Mm-hmm. Well, and Christy, to your point, and thank you for speaking up as somebody who's dual licensed by both agencies, I also want to be clear that we do not want any kind of dual licensure between AOE licensees and OPR licensees. What we're envisioning is that if you're an early childhood educator, you're working in those CDD regulated settings, you can come to OPR and get a license. If you're already licensed by AOE and you have an active early childhood education endorsement through an active AOE license, you're exempt from any kind of OPR regulation. So we really don't want to create regulatory burdens on folks who are helping our children, who are serving our kids and our communities. So we would exempt those AOE licensees so that we don't have that same dual licensure issue, Christy, that you do with your speech language pathologist license.
Thank you, Jennifer, and thank you, Christy. I do want to open the floor for public comment. If you would like to, please raise your hand. Sandra, I saw that you posted in the chat. I'm happy to go to you first, and folks are more than welcome to turn their cameras on or send me a message. Go ahead, Sandra.
Sure, yes. So I am curious if it's typical for OPR to license a group of folks who don't necessarily match the same qualifications and proven competencies with the same title as a group of people that's licensed by another agency. Is that something that's been done before?
I want to be sure I'm understanding your question. So I'm sorry, could you repeat that?
Yeah. So is it typical for OPR to approve a license for a group of folks using a title that's already licensed by a different state agency and the qualifications don't necessarily line up?
I mean, this is definitely going to be a unique program at OPR. And I understand that the use of the title early childhood educator for a lot of folks, that's something that folks are not interested in having. We're using the title early childhood educator is really meant to convey that professional preparation, the formal education that's required, the experiential component of the preparation pathway for these folks. So I understand that a lot of folks don't like the use of the title early childhood educator, but it is really meant to convey that professional preparation for folks in this workforce that's going to be required. So
thank you. Thank you, Sandra. Thank you to Jennifer. Sharon?
I just want to, first of all, just say thank you to Jennifer and her team who have done an incredible job learning about a really complex, fragmented system that we know is part of the reason why there's so many struggles with terminology and qualifications and all of the pieces. And I think that what this is giving us the opportunity to do is to address some of those issues when ultimately we all agree that a well-prepared early childhood educator is what's best for children and what's going to help children get off. I mean, we've just looked at the state data, and we know how important it is to have that early experiences be so positive. And so while we may be struggling with change and some terminology, I think that the ultimate goal is of worth. And I think that it was a really robust research process that was handled neutrally. And I think that the recommendations, early childhood, the workforce that are working in these CDD regulated programs, many of the voices that have been represented in the task force, this is what they feel like they are ready to be accountable for. And with the investments that have happened in preparation, I think that this very thoughtful transition is going to help us live into a future. Knowing that this is not just Vermont, this is a national initiative. And I think that that is like we're talking about the ability for someone to take their qualifications and have a clear career pathway where they can start at one level and is EC1, and they might choose to have an AOE endorsed license. So I think that it's actually giving clarity to build our workforce and retain our workforce in a way that is something that is also a priority for us. And I think that if we're talking about a national profession, it doesn't really make a lot of sense for Vermont to have something that is different from the direction that the nation is going. So I just want to say, I know the work that went into this and with unknown outcome, and we don't really know what will happen in the legislature, but I think that it's a really useful document, and I suggest that take the time to look into it and really look at the analysis, because I think it's really powerful.
Thank you, Sharon. All right, we are already 5 minutes over our time. I want to say a quick thank you to Janet and Jennifer for coming in and sharing reports that have just been submitted to the legislature. Again, the intent is for you all to know about these things, for you to be able to communicate with each other about those priorities, for you to have a sense of each other's perceptions of what's happening in that space, recognizing that even when we have very aligned high-level goals and priorities, sometimes our strategies, even across board members, are not the same. And so how do we come together and say what is best on behalf of kids and families, and how do we support each other in coming into this legislative session with as much of a united voice, understanding where there is consensus and where their tensions lie. So I appreciate you all being able to come into the space and have really thoughtful discussions about your perspectives in each of these areas. And as we end today's meeting, I think it's really important to just very briefly reflect on how we are monitoring and advising at the national level. So for those of you who have heard us talk a lot about data and policy issues in the state of Vermont, one of the things we are also doing as a team in really trying to understand where we in Vermont are situated in early childhood is be very closely connected with several different national early childhood partners, as well as our federal delegation, to understand the biggest policy levers, the priorities, and the challenges that may be coming with a massive shift in the administration. And from our perspective, really using the information that we have about what's coming federally to think about what we need to be doing in Vermont to support kids and families. So for those of you who are already paying attention nationally, this won't be new for you, but we are paying very close attention to a series of executive orders impacting diversity, equity, and inclusion, LGBTQIA populations, immigration, federal workforce policy, among so many others. We're also hearing and monitoring significant proposed changes to and cuts to Medicaid, TANF, different tax credit programs. And I think what's most important that we are hearing and talking a lot about is how those changes will have such significant impacts on our state budgets and the ability to meet the needs of our youngest and most vulnerable kids and families. We're also spending time consistently talking with our federal delegation and really trying to elevate what we are hearing from our families, communities, from the data, from our legislative and board conversations about the key priorities, and really looking to them to say, okay, what do we need to pay attention to that's going to impact kids and families, and what data and information do you need to help be able to elevate what Vermont does really well, and where do we really need to hold the line? When I think about the role of the State Advisory Council in this board and Vermont's role nationally, it's our responsibility at this moment to identify, maintain, and improve all of the key programs and policies that are in place for kids and families, and recommit to the values and the vision that we have for Vermont's early childhood system, which means protecting the lives of and the rights of our youngest children. So when I think about our collective and individual advisement, I think it's really important that at the state and national level, this group is coming together and having hard conversations like the one about quality and what it means and how we can do it really well, where we're leading the country, and where we have opportunities to learn from others. So I appreciate you being in this space with us. If you want to follow up with any of our presenters today, we are happy to make those connections. I'm really proud to have this group of experts in this space to have hard conversations about what's best for kids. So I appreciate you being here and look forward to meeting with you several times throughout the legislative session. Thank you. Have a great day.